Okay, so for this portion of the video, we're going to be administering the PO medications, which in my previous video, I've already identified my patient with 3 different identifiers, name, date of birth, and she was speaking with me. And then I'm also going to, I already verified my 7 rights. So we're just going to keep going on with the, like I said, the PO medications. So the first one I have here is Lanoxin, 0.125 milligrams, PO. So I have my Lanoxin or digoxin, either way. I'm just going to do another check on it, make sure that it's not expired, which it's not. And then I have my med math that I've already done. So the pill comes in, let's see, 0.25 milligrams, and I want to give 0.125 milligrams. So, oh, sorry, yeah. Okay, so I'm going to end up giving a half a tab is what my med math came out to be. So I also verified in my drug book that this pill can be crushed, and it can be crushed split. So I'm going to have gloves on, and I would have washed, for this video, I would wash my hands for 20 seconds before administering any medication. Let me stick these on here. So, and also with Lanoxin, one of the things you do, you have to listen to the apical pulse for 60 seconds before administering this medication, which I have on my patient, and I wanted to make sure it was above 60. My patient's pulse was 75, so that's great. If it wasn't above 60, I would not give this medication. I would contact the doctor. So I'm going to open my med here. Like I said, it's not expired, did that check. And I'm just going to stick this in my med cup so I can keep it with me because I know what I have. For the pill cutter, I'm going to clean it with alcohol first just to make sure I don't give any other medication to my patient that I don't want to. Alright, I'm going to let that dry. Here. So then I'm going to put my pill in the cutter with the score tab side up. I'm going to get it right in the middle, as much as possible. Do some push down. And then I'm going to stick the half that I don't want in with the label so I know exactly what this is, just in case I drop it or I need another one. And then I'm going to stick this in my med cup. Another med cup on top of it. And for video purposes, my patient has dysphagia, has a hard time swallowing, so I'm just going to mix it with a little bit of applesauce, which means I'm going to crush my pill first. So I'm going to stick it in our handy dandy pill crusher. Crush. Okay. And then once my pill is good and crushed, like I said, I'm just going to take a spoonful of applesauce. I'm not going to mix it with the whole container so I can make sure that my patient gets the entire medication. And so then, because that's been full, I'm going to administer it to the patient. So there's that. And that has been given. Okay, and then for my next medication, let's see. I'm going to give my Preventil 2 puffs every 4 hours while awake. So I'm going to get this all together, make sure that it's the correct medication, and that it's not expired once again. And then I'm going to use a spacer with this one, so I'll just take the lid off here. It's going to fit right in here perfectly. I'm going to instruct my patient to completely breathe out. And then I'm going to have them form their, this is my patient spacer, so I wouldn't need to sanitize or anything, only she's the only one that uses it. I'd instruct her to put her lips securely, firmly around this, and then I would tell her to take a big deep breath while pushing the medication. And then I'm going to ask her to hold it for up to 10 seconds just so the medication can get deep down in their lungs and help. With her having pneumonia, sometimes it might be hard with coughing and stuff like that, but just have them do the best that they can. And then I would wait about a minute and have the second puff. And so there's that. I'm also going to want to listen to long sounds and to see if that helped, and just monitor her as well. And then the last one that I have for this video is the acetaminophen elixir, and that's for, it says 650 milligrams PO every 4 hours for a temp above 101. I did check my patient's temperature before doing this, and it's 104. So I am going to administer this medication. I've already done my med math here, so like I said, we want to give 650 milligrams. And in this bottle, there's 325 milligrams per 5 mLs. It's not expired, it's the right medication. And so with my med math, I'm going to end up giving 10 mils. So for that, I'm going to put this here. I'm going to make sure that I keep my label covered with my hand, because this can ruin the label and you may not know what you're giving. And so I'm just going to find it on here. I'm going to get down level with it and slowly pour it in here. Okay, I'm going to get right up to 10 mils. Double check that, make sure that's correct, 10 mils. And then I would give this to my patient. She would swallow it. And for the elixir, she does not have a swallowing problem. So, okay, so then also for this video, we're gonna have to go over the Lubriteers. So what we do for that, we would just pull down the conjunctiva and insert 1 drop in the pocket in each, it says each eye, so I would do it in each eye 4 times daily. The Afrin saline nose drops, the Lubriteers is for dry eyes. The Afrin nose drops, with her having pneumonia, you never know. She could be having irritation with her nose, so it's just 1 drop in each nair. If it's a spray kind, I would just plug 1 nair, have her breathe in while spraying it in each side. And then the Otic suspension, 10 drops in each ear. Since she is an adult, I would pull her ear up and back, have her tilt her head to the side, and insert the drops in her ear while I had her ear pulled up and back. And that concludes everything for this video. Thanks!